Heartburn is a very common symptom in pregnancy, and it tends to occur more towards the end of your pregnancy. And some of the things that you can help to avoid that, of course, are avoiding spicy foods. You can actually take over-the-counter medications that are readily available for indigestion that your doctor will go over with you. The other thing is to try to avoid a lot of liquid intake and drinking a lot of liquids in the evening right before bedtime, because that definitely will seem to aggravate the heartburn.
Because of the pregnancy and the hormones in pregnancy, the GI tract is slowed down. The stomach will reflux a lot. You'll get a lot of reflux, indigestion, things like that. So again, you can, if you're having those problems, you can avoid spicy foods. You can take antacids. You can take Tums. You can take Mylanta. Even some of the over-the-counter. Again, we avoid medications first trimester, but as we move into second and third trimester, which is where most of the, particularly third trimester, indigestion slides in, we can use some over-the-counter H2 blockers, things like that, Pepcid AC, that kind of stuff.
Heartburn is very common in pregnancy. A lot of it is because the pregnant uterus is pushing up against the stomach, increasing pressure, causing dilation of the lower esophageal sphincter. So we want you to, when you sleep, elevate the bed a little bit, about 45 degrees. It helps with the gravity and keeping the acid down. Of course, avoid spicy foods. And if it continues, definitely talk to your doctor, because it could be something else. Unfortunately, though, the heartburn can cause a lot of stress to you. It could cause stress to the baby. The heartburn, also the acid reflux, could damage some of the tissue in the esophagus, and in some chronic cases could even lead to cancer. So we want to avoid any excess heartburn. Caffeinated drinks do it. Chewing bubble gum, caffeine could also increase heartburn. Unfortunately, though, when it comes to the spices, we try to, if it bothers you, if we find out that it's the spices, would have to tell you to kind of go bland.
Muscle cramps or aching legs in pregnancy is a little bit different than the aching legs we see in our adult population. A lot of times in the adult population it's thought to be potassium related or calcium related. I think for most part in OB patients we tend to see it more related to zinc and magnesium, and if we're having a lot of problems we'll recommend a zinc or magnesium supplement. There is some in most of the prenatal vitamins, but sometimes we have to boost that up a little bit if the cramps are getting real bad.
Oftentimes some of the things that can help with that, of course, are elevating your legs whenever you're at home and able to rest. Of course, you want to wear flat shoes, and just increasing your calcium intake. A very easy way to do that is taking Tums can sometimes help with cramping, because oftentimes it's a sign that your calcium level is lower than it should be.